Hello, everyone, and welcome to this webinar presented by the Better eHealth project, together also with the WHO Digital Health Atlas on eHealth policy making, strategy development, and implementation, and especially how a platform like the Digital Health Atlas and also the Better eHealth registries can help with that, how they can be a value in such eHealth policy developments. I will just start with a brief overview of Better eHealth as a project, but I think many of you are already quite aware of what the project is and represents. It is an EU-funded project looking especially at eHealth implementation in Africa and how that implementation can be supported, how policies can be developed and implemented. These are the partners in 4 African countries, plus also a number of European partners, and the overall project is coordinated by SINTEF in Norway. These are some of the specific things that we are focusing on in the project and some of the activities, and especially for this webinar, the topic of this webinar, of course, the collection and mapping of resources is very important and relevant, and that is what we have been working on in one of the tasks of the project, and with the development of a registry of eHealth policies and of eHealth solutions. The registry is available at this website, registry.betterehealth.eu, and it is, of course, very much about offering information that can help to identify best practices, lessons learned, so that people, policy developers, implementers, but also funders, donors, industry representatives, researchers, etc., can find out about what is already out there, the experience, and also the specific solutions that are there, and to use those for their own benefits and for their own eHealth policy development and implementation. This, of course, is very important within our project. We have, as I mentioned, partners in 4 African countries, and they have been setting up regional eHealth hubs where they have been and are working with stakeholders within their regions, and thus covering the whole of the African continent. We encourage you to join these hubs, these virtual hubs, if you aren't already a part of them, or if you aren't in touch with them yet. So through this link on the Better eHealth website, you can submit your interest. And then we actually have 2 in-person workshops coming up, one for the Northern and Western Africa regional hub that will be held in Tunisia next week already, and then the week after in Addis Ababa in Ethiopia for the East and Central and Southern Africa hubs. So there is still opportunity to join us there if you are able and willing to. So feel free to contact us for information about that. And I also would like to make or use this opportunity to let you know that we will be involved also in the Africa Digital Health Summit at the end of June in Nigeria. We will be also setting up a session there on policy making and implementation. And also our partner, the Africa Health Tech Hub, will be presenting the winners there of the innovation challenge that they have currently running. So that will be quite an exciting event. So that's all from me in terms of, let's say, introduction and a brief overview of Better eHealth and also our registries. These are some of our contact details, but I would now like to hand over to Salim Azzabi from the World Health Organization, who will share some information with us about the Digital Health Atlas And then he will be followed by our colleagues and representatives from the Ethiopian Ministry of Health and from Malawi Ministry of Health, who will share a few insights from their side. And then we move into, let's say, the open discussion with all participants, also including our partners and colleagues from Ghana, the Ghana Health Service, and NITA, the National Information Technology Authority, who will also join the debate. So over to you, Salim.
There you go. Hi, everybody. So my name is Salim Azzabi. I work for the World Health Organization in HQ, headquarters in Geneva. So mainly at the department, with the Department of Digital Health and Innovation. And one of the aspects we're working on is part of our strategy, and then we'll maybe define a little bit what is our strategy. So mainly like the guidance principles of a strategy, and I don't want to go through it extensively, is like we have a global strategy on digital health to be executed between 2020 and 2025. So mainly like the objectives, there are like 4 objectives, and part of the objectives are like something we're working on with the Digital Health Atlas, which is global collaboration and transfer of knowledge. And then as well, like strengthen the governance like for digital health at the global and regional level. So going into like implementation part, I want just to kind of refer to the guide that we are using as well in helping like member states to execute their implementations of digital health investments, which is called the Digital Implementation Investment Guide, that like shows like 7 steps to go through to execute like an investment in digital health. Like a very like it's a guide we refer to often to kind of like go through like all the steps and make sure that like we don't miss a step, or make sure that like we include all the stakeholders and execute in a way that like it's going to be successful. One other thing that we did with the WHO guidance wise, or kind of globalization wise, is we provided with a classification for digital health investments and interventions. So the classification, I'm not going to go through it like very thoroughly because we have only 5 minutes. I would prefer we have more questions than kind of like a presentation. It just allows to kind of like have a common language for classifying this kind of investments and be able to kind of like query the data afterwards in a way that is like consistent and be able to extract the information, decision-making information. Just quickly, like the classification anchored like through three axes, which are like the digital health interventions, the system challenges and categories. Just a quick like overview of the health system challenges here. I'm not going to go through them completely. You can go to the document if you need to go through it. There's the system categories here that are defined, and then maybe this one is like more mainly the explanation on how it's used in a way that like you come from a challenge, and then you put up like a digital health intervention that would like solve the challenge, and then you categorize it according to the systems that are in place, which is like either logistics, telemedicine systems, or electronic medical record, or other things like that. So that allows you to kind of like classify the intervention. So coming back to our like main topic here, which is Digital Health Atlas, which is mainly like a solution here for like inventorying like digital health investments within the ecosystem globally. And the idea comes, or like the use, why we need to this kind of tool, because right now executions are siloed, they are uncoordinated, inflexible. We have like duplication of executions. There is no interoperability between systems and others. So we're trying to kind of get more collaboration, knowledge sharing, and governance to happen through this, through like the use of the Digital Health Atlas. Mainly focused on 3 actors: government officials, implementers, donors. They all want to achieve the same thing, but as mentioned before, they achieved it in a way that is siloed very often, and then they cannot execute like in a way that is like optimum for results. So, and the area of focus here is like the strategic level, tactical or operational level. So the DHA could be used in the different levels. We don't expect it to be used in only one. So yeah, we developed a tool, which is a global good called Digital Health Atlas, where you can record your interventions, be able to kind of like as well look at interventions that are happening within the countries for developing your strategies, developing your policy making or other things. So it's under the digitalhealthatlas.org that you find the tool. I'm gonna just run quickly a video to run you through how it's used and how it looks like. Video is better than just like me talking. So we'll go through it in 2 seconds. Oh.
The Digital Health Atlas, or the DHA, overseen by the World Health Organization, is a global web platform that supports governments, implementers, technologists, and investors to inventory digital health projects globally. It can answer the question of which software applications are being used at which health facilities in any given country. Currently, many digital health investments are made in a siloed and uncoordinated manner. This can lead to duplication of efforts and inefficiencies between stakeholders. The DHA is a WHO-maintained open data platform and a global good that provides stakeholders with a standardized way to access, record, and share information on their digital health projects. When stakeholders and governments can see the applications that currently exist and which interventions they deliver, this can improve planning and coordination of digital health investments, accelerate tool development, deployment and uptake, and support the harmonization and interoperability of digital health systems. Ultimately, this results in more impactful digital health investments, which lays the foundation for improved health outcomes. Let's explore how the Digital Health Atlas provides value by examining some common use cases across stakeholder groups. Researching projects to design a health intervention. A group of Ministry of Health officials are working with an investor to design a national immunization program that utilizes an electronic registry. Before issuing an RFP for a new immunization registry, they want to know if there are existing digital health interventions they can tap into and scale to support their new national immunization registry. First, the officials create an account on the DHA, which enables them to view all digital health projects at the global and country level. They use the DHA dashboard map view and choose the health focus parameter to filter projects. Seeing the landscape of digital immunization projects like this allows investors and ministers to identify the projects that might have technology solutions they can use for their registry. Next, the ministry officials and investor view the first 3 project profiles amongst 4 shortlisted ones, but find that they do not meet their needs. They click on the 4th and largest project's profile to examine its specific capabilities. First, they see that it uses open source software and includes most of the interventions on their priority list. The ministry has worked with the implementing partner for past national efforts and has confidence in the partner's ability to execute quality work. Next, they see the project has a high number of users and is already at a stage of continuing to scale up. All of this information reassures the officials and investor that this tool includes what they need and that it has been piloted. They access the project implementer's contact information and reach out to discuss their national immunization effort. They have the option to export the shortlisted project.
There we go. I'm going to stop here because I don't want to do the whole story, but at least it gives you like an idea of how it's used. So yeah, mentioning like the strategic level of Digital Health Atlas, so it can be used to analyze the digital health investment landscape. It can be used to monitor if the strategy is implemented, to disseminate national digital health reference documents, to leverage synergies between other strategic players for more impact. The planning as well, so to analyze, leverage synergies as well, synergies between communities of donors that are in place for better planning, and so on, and as well identify weaknesses and opportunities and plan accordingly. And then implementation-wise as well, they can reuse an interoperability between systems, and they can be informed of like the latest national digital health reference documents, so they can implement according to the strategy of like the country and so on. So yeah, just coming back to the plan, the dig that I just mentioned, the guide that was like presented at the beginning. So this is where like the different phases where the digital health atlas can be used. So it can be used at the assessment, level, at planning the architecture, at like monitoring and evaluation, implementing and maintaining and scaling. So this is the different levels where we can engage with the digital health atlas to get information or to take some decisions. So mainly, and then the 4 DHA step strategy is like, it's coming from data collection that we're like more in now, and data processing, meaningful information, bringing meaningful information. But now, once you have more data, you start to be able to analyze and then identify patterns, relationships, and trends that would like kind of be able to as well like inform your policy making, and as well at the end like disseminate this data to the appropriate stakeholder to bring in the right information. So yeah. That's it from my side. I think I did more than 5 minutes. Sorry for that, but let's go for the questions after. Thank you.
Yeah, thank you very much, Salim, for this overview of the DHA Digital Health Atlas and what it brings and what it aims to do. So we will indeed go further into or discuss, how policymakers, how national governments and other stakeholders can and should use this or even contribute to it as a meaningful resource. Let's now first hand over to David Birhan, who is a technical advisor at the Health Information Technology Directorate at the Ministry of Health in Ethiopia. So we hand over to you, David, to share a few slides from your side with some introductory information on some of the things going on in your country. I think also with some information on the digital health projects inventory that you have also set up in Ethiopia.
Thank you. Thank you. So is this visible?
Yes, we see the presentation.
Okay, thank you. So I'm from the Ministry of Health of Ethiopia. I am working there at, we have a department called the Digital Health Lead Executive Office. So this is the director which leads all the digitalization efforts in the country. So I will have a brief introduction about some of the activities in our sector, and then I will talk about some of the digital health policies and strategies which are a framework which guides the digital all over activity in the country. And then finally, I will talk about the digital health atlas, those which we are currently using in Ethiopia, and the one which is present by WHO, which is the WHO Digital Health Atlas. So as I said in the beginning, we have just a new restructure at the Ministry of Health of Ethiopia, and as a result of that, our department, Digital Health Department, has now a new structure, and we will be directly reporting to the State Minister. And our naming is now changed from Digital Health Directorate to Digital Health Lead Executive Office. And under that Lead Executive Office, we have 3 desks. We call them desks now. Previously, we were just teams. So there are Digital Health Governance Desk, which is directly responsible for governance activities, and then Digital Health Services Desk, which is mainly concerned about implementation and development of digital tools. And then we have a desk responsible for HealthNet and data center activities. So as you know, in Ethiopia, we have a special project, HealthNet project, which aims to connect all the health facilities in Ethiopia with a virtual private network. And so health data could be securely exchanged among health facilities, both horizontally and from bottom level to the ministry level. And also we have a separate department as a ministry, which is directly responsible for ICT activities in the ministry. So it's a separate department. Now we have 2 departments. So the idea is now we have this structure as a ministry. We wanted to cascade it down to all the regions. As you know, Ethiopia is a federal state. So the plan is to mentor the other regions to copy from us and to coach them how to do so. So at the end of the day, we can work together collaboratively. So let me jump to the digital health policies and strategy documents we are using as a ministry, which guides us in our digital health investments and activities. So as you might know, we have the Ethiopian Health Architecture, which is a framework which guides us how the different digital health initiatives are implemented, how at the end of the day, how they are going to be able to talk to each other. So we have tried to classify the initiative at different categories. We have point of service applications and systems. We have the shared service where we implement the registries and the likes. We have the different categories, and also we're talking about also analytics and business intelligence, which also at the end of the day want to analyze the data we have. And also the Ethiopian Health Architecture talks about integration with other external systems. As you know, health is not an isolated system. We wanted to give data for external bodies. Also, we have to bring data from external systems. Like, for instance, we want to make interoperable with financial system, with agriculture. For instance, we have the nutrition data and the like. So it's not only about this framework is not only about the health sector only. Also, it talks about integration with other external stakeholders. And we also have a national digital health strategy, which is a 10 years strategy. It starts from 2020 up to 2029. And this one is really aligned with the health sector transformation plan. So as you might know, the HSTP2 is a national guiding document for the sector, and we want to make sure that digital health is also aligned with that initiative. So this particular document tries to make sure that digital health is really supporting that strategic initiative as a sector level. And also we did just recently an app inventory. Actually, it's 2 years or 3 years back. So we did also sort of inventory of the digital health systems and applications which are both throughout the country. So the idea was to identify applications which are currently implemented in the country in different parts of the region at different type of facilities, be it in health center, hospitals, or teaching universities. And also we wanted to manage the resources because as previously presented by Salim, we wanted to make sure that there is no reinvention of the wheel. We have to make sure that what are there out there in our funds, and whenever there is any initiative, we have to make sure that it's not a repetition of work, or if there is sort of collaboration with the existing digital interventions, we have to make sure that we are aligned with that. So with that objective, we did a sort of app inventory. You can call it as a census of application we have so far in the country. And with that inventory, we came up with app inventory analysis document, and we found that there are around 228 applications throughout the country. And among them, only 77 of them are unique. So you can imagine how many of them are repetition of works. One with the other, they are overlapping. So this is one thing we want to know where we are at this stage before we envisage the future investment. So this eHealth app inventory has achieved the objectives where we are now, what kind of solution do we have, and which of them are particularly unique, and the others are really a repetition of works. And also just recently, we did a directory of digital solutions in Ethiopia. So we published the document. So this document is concerned about the various digital initiatives implemented in the country, both by private institutions and by the government. And also on top of that, we tried to incorporate some of the government frameworks, the governance frameworks. I just introduced to some of them in the previous slide. So we have just published this one in paper format and distributed to various stakeholders. So it's a sort of atlas which shows which kind of applications are being developed by private institutions. Just recently, we did have a digital health week. And in that digital health week, we have gathered almost 30 private entities which are directly working in digital health implementations. So we try to capture their information, and at the end of the day, we published it so that others know what kind of solutions are being developed by private entities and also by government institutions. So this is one of the publications we did just recently. So let me come to the final topic, that is the digital projects inventory, which we have in Ethiopia. In Ethiopia, as I previously told you, we have tried to both cope up with the WHO Retailers Atlas, and since we have special needs from our own side, we have tried to develop an application by ourselves. So we have developed it here as a ministry with collaboration with the universities, and we deployed it as a ministry level. So it's accessible globally by a hyperlink. So the application mainly is captures information for us about the existing digital solution, their geographic distribution, as any digital atlas, as you know, their intended purpose, the technology, what kind of technology there. And as the end of that bullet, as you can see, we want to know the alignment of that specific tool with the Ethiopian health architecture, because the Ethiopian architecture is our blueprint. So whenever we found out any digital solution, we want to know where, at which category it falls. So this specific platform will categorize the digital tools at which kind of categorization in the Ethiopian health architecture it falls, be it in shared service, whether it's in the point of care application. So that's one of the advantages of our digital health project inventory system. So these are the driving needs to develop our own digital health project inventory system. Some of the are maybe they are well known. We want to make this as a tool for collaboration. As I told you, we want to visualize and report what kind of solution we have in the country, or what kind of a specific purpose they are doing, their status, who owns them, and the like. So this is a platform we want to share information with our stakeholders, and as a means for collaboration, and also at the end of the day, avoid repetition of workers and wastage of resources. So this is the tool we have. This is a screenshot I took from our application. It talks about digital project inventory. It's digital clearinghouse and both a clearing registry tool and a certification tool. So this platform has many purposes. One of it is to register digital solution, and also we want to make use to certify tools in Ethiopia. So that's also another intent of this solution. So it looks like that. So as I told you, if you have new projects, we have under evaluation. So after we make evaluation, we want to approve them and provide them a sort of certification for a certain period of time. That is the purpose. So we have the status, we have the status, we have 16 new projects registered by different clients. They can register online their solution, be it private or partner institutions. So if there are two processes under, there are applications which are under validation, it will be visible here. And also if it's under approval, then if it's approved, they can follow up their status. And then also it will categorize, as I told you, in which category of the Ethiopian health architecture it is falling. So the other is number of projects in coverage. As I told you, we have different regions in the country. So we want to know the geographic distribution. So the dashboard shows us where are the physical distribution of this solutions like. And here is also another screenshot. It shows about the project name, the contact info, the status, and the likes. So as I mentioned previously, beside registering application, we want to also provide a sort of recognition for application which fulfill our requirements, so that we recognize that this particular digital solution is registered by the ministry by fulfilling the basic requirements under the digital health inventory project platform. So for instance, we have registered the MFR solution. We have in Ethiopia this National Master Facility Registry solution. So it is duly registered on the Ministry of Digital Health Project System in conformity with the minimum access table requirements. So we provide this kind of certification both for private entities and for government-owned solution, also partner-led initiative. So this is the kind of extra process we are doing with our digital health project inventory system. And so, as you all know, we made sure that this information is not held only in Ethiopia. So we will directly propagate it to the WHO Digital Health Atlas. So when we design our digital health project inventory platform, we try to make sure it is interoperable with the WHO Digital Health Atlas. So we can easily download information in CSV format from our platform and directly push it to the WHO digital atlas. So we are not missing the links with our platform, with the WHO platform. And also we have another process we do as part of the project registration. So we have a repository for source code for application. So as part of ensuring the institutionalization of digital solutions in the country, when we register them in our platform, we make sure that they push their source codes on the repository we organized at the ministry level. So we have a registration, and as part of registration, we will request them to directly push their source codes to the local repository we have at the ministry level. And also, as part of the digital health project inventory system, we are trying to do a sort of quality assurance for our digital health initiative. So we make sure that whether it comes from private, partner, or program agency, it fulfills all the requirements either by the registry or the individual requirement or the non-functional requirement. So as the end, we'll provide them a quality assurance software. This is a higher level than the previous certification I told you. That one only talks about registering as the digital data. This one is talk about the individual testing, at the same time registration on our platform, and also the non-functional, the security, the performance things. If all these things are successfully tested and verified, we will provide that a quality assurance certification. So this is the process we do. We do pre-registration things like whether there is a memorandum of understanding, whether there is project charter, and whether it's registered in the digital atlas. Then after doing user active testing and the likes, we would like to give them user active quality assurance document. And then even after the implementation, through regular monitoring, we want to also provide post-implementation quality assurance. So this is the result of the digital project inventory solution we have in the ground, and consequently we see such kind of things based on such platform. So I'm coming to the end of my slides. So these are some of the opportunities we have as a ministry level. As I told you, the management is highly buying the digital initiative by the ministry. So we are lucky to have acceptance by the top level. So they are providing every assistance. As I showed you, we have a different structure which is directly responsible only for digital investment. These are a positive for us. And also there is a global experience for us. We are not doing these things from scratch. We have the WHO Digital Atlas and the next we can learn and benchmark from others. These are our opportunities. And the challenges are, as you might all know, lack of data in one of the digital solution. This is as a tradition. We don't get information from our tools, and also guidelines, policies. We don't have such things previously. And also ownership by the health sector. As you know, most of the digital initiatives are led by partners or implementing donors. So this is the challenge. So that is from my side. Thank you for your attention.
Thank you very much, David. Yes, indeed, for this overview of what you are doing, what you have been doing in Ethiopia in terms of registries, inventories, also publications on digital health apps and solutions and projects, which, as you say, is often very much about sharing what is existing and avoiding duplication, avoiding reinventing the wheel, and making sure that people or organizations can partner with each other or team up or at least learn from each other. And also good to see that there is already that link with the Digital Health Atlas, so more on an international and global scale. Of course, it's very important for you, these initiatives nationally, but across border and internationally, they can also provide a lot of value. So let's move on now to Malawi to hear from Elvis Mpakati, who's also a technical advisor on digital health financing at the Department of Planning and Policy Development at the Ministry of Health in Malawi. So Elvis, I hand over to you for also a short introduction on your initiatives and what's happening in Malawi.
Sorry. Thank you so much, Frederick. I hope you can hear me.
Yes, we hear you.
Okay, fine. So let me just share my screen a little bit, and then probably we can proceed from there. Okay, so I'll be sharing something what that we've done in Malawi. In particular, I'll be looking at the digital health policy and the strategy, and then move on to some of the things that we've done in that regard. Okay, so I think overall in Malawi we have a digital health policy that we are developing. It's not yet there, but let me give a background as to why we are developing a digital health policy. Initially, Malawi actually developed a digital health strategy based on the WHO guidance. Most of the countries should have developed digital health strategies because of the importance of digital health in the delivery of care. So the digital health strategy was developed, and then from that covered 2020 to 2025. But then when we started implementing the digital health strategy, we came to the realization that we could not implement it fully because there were quite a lot of challenges that we were facing, given that in Malawi, like most of the low-income countries, we've got a lot of stakeholders which are part of donors and then implementation partners. So there was need for government to have a tool to guide the harmonization, sustainability, and interoperability of the systems within the country. So that necessitated the policymakers said, fine, I think we need a policy so that we should be guided so that people can come together. This system, so many systems were there or were introduced, and then people were working south, and then the investment in digital health was not the proper channel to the needs of the government. So at that point, that's when we said we should need to develop a digital health policy. So the digital health policy has been developed, particularly focusing on to solve some of the solutions, some of the gaps, or to address some of the gaps that to do with focus on having a harmonized digital health solution, sustainable, dependable, interoperable, and secure to comply with standards. So that happened. So the policy, it wasn't easy to come up with the policy because there are some, of course, we made some resistance, but eventually that we started working on it. So first, we had the digital health experts who developed an outline of the proposed policy. And then with that, then we key digital health stakeholders were invited to policy formation workshops. So these workshops mostly would cover about 3 to 4 days, involving technical experts to come together to tease out some of the things that we need to include in the policy. So far we conducted about 6 workshops and then 3 consolidation meetings, and then those were concluded, and then we presented a draft of the digital health policy to the technical working groups for them to provide their input. And then after that, we're expecting now we can take it to the senior management from the senior management of the digital health to approve the policy, and then we can launch it in the next few months. But that has been our journey. So the policy, the digital health strategy, if we're looking at it as a way of now trying to as an implementation plan for the digital health policy that we've developed. So the focus of the strategy is to address some of the objectives that have been outlined in the policy, and then having specific strategies which are addressing those objectives and in specific activities. So that's where we are, and we think that we're going to gain more by using the policy tool. But also I should mention that even though the policy is not yet in operation, we've already started implementing some of the things that we are trying in the strategy. For instance, at the moment, using the digital health strategy, the digital health division is working with the central hospital to develop the hospital-wide information system, which we think is going to be a game changer when we implement it in this country. So I think that's what it's about. I'm not going to go dive more into that, but actually suffice to that, again, the digital health strategy is there already published, but again, that digital strategy actually now we are making sure that it's in line with the policy that is being developed. In terms of the in terms of the address, we worked with WHO last year. We developed a digital health address for Malawi. In the address, actually, with the support from we managed to include all the systems that are in operation in the country, and also where they are and what they are doing and who is implementing them. And then that information is available online. So we think that actually but we're still working with WHO to see that actually we can update it, considering that some things have come up recently. So I think that's what we've done so far. Thank you.
Thank you very much, Elvis. And well, the final remarks, obviously, about already collaborating and working with the Digital Health Atlas are very encouraging. It shows that there is a value there. There is something to be had, and I think a lot of countries are in the same position with policies and strategies having been developed, but where there is useful information and practical information also around the tools and the solutions that could be very useful to implement ultimately the strategies in the field. So that I think is very worthwhile and shows that platforms platforms like the Digital Health Atlas serve a big purpose and have a meaning there. So with this, we have finished our introductory presentations and an overview of what, in this case, 2 countries in Africa have been doing. As mentioned, we also have our colleagues from Ghana on the panel, Ghana Health Service with Sam Kwarshi, and then also the National IT Authority with Musa Issa. So I would actually like, to open the panel discussion, especially also with you, Salim, to discuss a bit more and requirements for the Digital Health Atlas. What are they looking for? How can it be useful to them? What are some examples that are already out there of using the Atlas, but also contributing to it so that others can benefit from that practical experiences that others have built up? So is that something you can delve into a bit more, Salim?
Sure, from my side here. Yeah, no, I believe we are at the stage where we have more need for data collection to be able to bring information and analysis to the Digital Health Atlas. I think it's important that we know what kind of information is expected at the end, because raw data doesn't mean anything. It needs to be analyzed. And this is where I showed the strategy where we go from data collection to data analysis to data to decision making, and then knowledge sharing with stakeholders. So I think this is what we need to kind of focus on. And then what would be interesting to know is the user journey of executing a policy making and how it's achieved, and where are the pain points that we could relieve by bringing this data, what is the expectation. So that would be interesting to see how we could do that all together. The other thing I want to mention is seeing the repository from the collection that was just presented now, that is happening at the country level. It would be good as well to bring in this data within the DHA and connect it, because you are already certifying some data and all of that. It doesn't need to be all the data. It can be mainly the data that is can be shared, because maybe sometimes at the country level they don't want to share all the data because it's kind of very sensitive. But at the same time, it's good to bring it at the global level. Why? Because you want to do that. Because you want to do that to make sure that other stakeholders that are coming within the country to invest, like donors or other partners, are aware of what's happening in the country, so they don't invest, duplicate, or like at least like augment the investments that are already in place, instead of bringing new investments that are duplicating what's happening or not knowing what's happening and then not interacting with what's happening already. Or like, for example, I think there was a show, like a show off of the architecture, the digital health architecture, systems architecture, that to make sure that they are aware of this architecture and this like tools to connect with them, and then be able to kind of like create like a sound like solution, not a solution that is siloed, that is brought without having any insight on the strategy that is followed by the country. So yeah, I don't know if like I can talk more on this, or Frederick, I prefer that like people ask questions or bring information.
Yeah, maybe as a first step, it might be interesting to hear from Musa Issa from Ghana, maybe some thoughts on what you saw and heard from the colleagues in Ethiopia and Malawi, and more general what Salim presented on the Digital Health Atlas, and how in some of your activities and developments in terms of digital health and e-health policy and strategy and requirements, how that can help you, or maybe bring some requirements to the table in terms of what would be useful for you to find in the Digital Health Atlas, or in what format, etc., so that it can help you in your activities and your implementation in Ghana. And the same question goes to Sam as well, of course, Sam and Musa together.
Indeed, thank you. Indeed, the rationale for the Atlas is something that we have adapted, and hence created a standardized way of doing things. For instance, we have a national enterprise architecture for which sectorial architectures will derive their designs from. The eHealth, the health environment has a health architecture for which any issues of digital initiative should be based on, without which progress in digital health will not be feasible. And that is something that will create a harmony and coherence in how we adopt digital health implementation. I learned a lot also from Ethiopia, how they have a unit that is carrying out health digitalization. In Ghana, we have an agency like mine that ensures that we regulate ICT and digitalization. We ensure standards, quality of service. Hence our involvement in what we are doing now. But the issue we have is compliance, how to ensure compliance, so that any digital health initiative complies with standard, which is critical. If we don't have such compliance, we have silo, as Salim indicated, silo initiatives that do not, at the end of the day, do not talk to one another. And it will create problems and costly in our attempt to digitalize our health sector. And that is what I observe with Salim's presentation, the need for us to have coherence and follow standards. Ethiopia also mentioned of having a repository, source code repository, said that all the players in the sector who have their solutions in case there's any challenges. You know that you have the source code. A situation where there's nothing like that, you have different varied players playing in the field without any control. When a player is out of existence, the problem that will be created will be huge. And that is also something that we can also learn from. And when we are building our digital health solutions, we factor in those good practices. I think my colleague Sam will give more information with respect to our environment, what we have in our environment.
Yes, Sam, if you just want to briefly add something on that, and then maybe also specifically reflect then on Digital Health Atlas and how exactly you use it or want to use it, and the kinds of information that are, would be very useful to you to have through such a platform.
Okay, so thank you very much. I think Salim's presentation was fantastic, and I'm also very jealous of what Ethiopia have just done, because we've had it on a drawing board. We want to do this, and then I see Ethiopia showcasing, the kind of stuff that we've been wanting to do over the years that is part of our policy guideline. I think it's fantastic. It's not about just having a policy guideline, but there's also implementation is very key. I have been with the health sector's eHealth ecosystem for almost 2 decades. And at the time when we started, the country started talking about eHealth, there was nothing like digital atlas, eHealth registry. We had no information. Okay, to start with any policy guideline on eHealth, you needed to collect the data, go on the field, try and understand what end users or health facilities were using, put it all together in some Excel, data sheet, and then try and make some meaningful use of what exists in the ecosystem in terms of policy guidelines. Now, moving forward, of course, with the help of WHO and ITU, when we started working on our eHealth policy and strategy, we had to adapt a model to guide in the policy directive, and also make sure there was strategic alignment with what the country wanted to do. For those of you who are aware, in the year 2003, the government of Ghana developed its first digital blueprint on the use of technology for the country, referred to the ICT 4AD. And within that document, there was a component for the health sector. So that provided like the building blocks for the use of technology in the digital transformation of healthcare delivery. So we moved from that to the health sector ICT policy and strategy. Then we got help from WHO to do an evaluation or an assessment of the eHealth readiness of the health sector. So that fed into our national eHealth policy and strategy, which was developed in 2010. And then we have a draft national digital health strategy for the health sector. Now, in all of these, for the final document, we had to collect lots of information, data, okay, and which form the bedrock of what we can refer to as the Better eHealth e-registry framework. So we have some baseline information on what was happening in the eHealth ecosystem, but it wasn't comprehensive. Okay, so the Better eHealth project enabled Ghana Health Service and of course the Ministry of Health to collect and collate information on the digital health solutions and initiatives in the country. Now aligning it or mapping it to the Atlas, WHO Digital Health Atlas, I think it's fantastic. There is no way you can make any decision without an understanding of the activities taking place in the ecosystem. It also was an eye-opener for the health sector, because then we got to identify that you could not move forward without some collaboration with key stakeholders like NITA. So NITA is the regulator of the digital space, and in terms of enforcing legal and regulatory framework, as well as compliance, you needed to work with the National IT Agency, the Cyber Security Authority, the Data Protection Commission, in terms of ensuring that the privacy of patients' data and other healthcare related data was adhered to, and likewise the confidentiality and availability of it. So I am of the view that not only is the digital health atlas important, it needs also to be guarded, because it's a rich source of information that impacts on, not only improving quality of care, but also looking at issue from a people perspective, looking at issue from a process and documentation perspective, as well as addressing the technology ecosystem in terms of enterprise architecture and standards, compliance, and standardization of solutions that is used in the eHealth ecosystem. So this is my initial comments.
Okay, thank you. Yeah, so I heard you say there is and there was a need for let's say national data collection and information collection, but also let's say the wider international input and perspective can be very useful when then further rolling out your strategies, your policies, and so on. Salim, I hand over to you, but also look at the questions that were posed in the chat. There was one for David about why did you develop your own platform in parallel to DHA, which special needs did you had? And then also for all the panelists about what type of analytical tools for digital solutions, but also for policies could be implemented on the DHA to support your planning, strategy, and policy making. So Salim, first to you, and then also if our panelists could look at those questions and then provide some feedback on that after Salim's intervention.
Actually, I want David to talk, because the question is relevant to the questions asked, like what is the need that you like solving that the DHA doesn't solve for you? And why implementing like an inventory that is like not global, first at the country level? And would you consider to create like a parallel inventory, or would you consider to use the Digital Health Atlas as your inventory solution in the long term? That would be interesting to know. What is the need? Why you wanted to have your own inventory and not like use a global one?
Okay, thank you, Salim. So, as you said, we are not creating a parallel solution in the country. At the beginning, as I told you, the WHO Digital Atlas was our learning ground to develop our platform. So initially, when we do the app inventory in the country, we directly copied all the metric inside the WHO Digital Atlas to enumerate the digital solutions in the country. But besides the WHO platform, we have specific needs in our context. Like as I told you, we want to use this platform as a quality assurance tool. So at the end of the day, we don't want it to be an end by itself. It's not by registering and sharing information. It's one thing, but we want to build something based on that. So as I told you, we are providing quality assurance and certifications for some of the platforms which fulfill requirements both on the platform we have in the country and some of the requirements we put in our quality assurance matrix. So that's one need. The other is, if I am not mistaken, the WHO Digital Atlas doesn't categorize digital applications based on the architectural framework, maybe global architecture framework, which shows at which category the digital application being developed at different parts of the world are falling. So you have showed us, like Salim Azzabi of the session, we have classified intervention on 4 categories, I think, not 5 categories.
Yes.
So it might be, for instance, in future consideration, some of the tools that are being implemented in the country being categorized in which category WHO categorization are falling into. So the special need from our side is we wanted to make it aligned with the Ethiopian health architecture. That's one thing. The other is we want to make sure that is the tool is owned by us. Some of the information we gather from for us is only relevant from our side, and the other information we collect are directly, we are pushing it directly to the WHO Digital Atlas. So you can call it as we want to own our own solution. It's not a direct repetition of the WHO Digital Atlas. We made sure that the information we gather can be directly pushed to the WHO Digital Atlas, but some of our special contextual needs make us to think about building our own platform. Besides, Ethiopia is a federal state, so regions can create their own information on the platform we have developed, and we can see the information from our side. And at the end of the day, centrally, as a ministry side, we can push it to the Digital Atlas. That will be more manageable from our side. So these are some of the specific needs we want to develop a tool which is more or less similar with WHO Digital Atlas, but more additional needs from our side. Thank you.
And just want to come back to like the analytics tool that are provided for policy strategy documents. Like what could be implemented, that would be like the question to the policymakers. That would be good. That like what are the questions the policymakers are trying to kind of like answer. As I said, we're on the stage of data collection, and data analysis needs to be kind of like improved, where we kind of like bring in the answers that people want from like at one point, but we need like to have enough data to be able to execute. So what would be like interesting, and if there's policymakers with us, is like when developing a policy, I think what are the aspects that were the questions you're answering, so we make sure that like we get them ready within this kind of solutions already in place to execute. So I don't know if it makes sense what I'm saying here. Go ahead.
Sure, if I understand you correctly. Sorry, I'm coming in. Okay, thank you. So as you all know, digital solutions are not by their own standing. They have to be aligned with the sector strategy initiative. So policymakers and planners want to know really digital interventions are aligned with the sector strategic initiatives. So policymakers and planners want to know such kind of information, what kind of digital solution we have at hand, which are directly aligned with our strategic initiatives. We have solutions which do something which may not be our priority initiatives, that may not be their concern. So policymakers want to see from our platform, what do we have, what kind of investment we are required to achieve our health initiative with digital analysis intervention. So this platform should show them what we have at hand and what we are missing to achieve the strategic objective of each particular nation's requirements. So that's my view in my side. Thank you.
Frederick, back to you.
Yeah, another question that was just put to us was, does the DHA provide a user-friendly interface for decision makers to insert solutions, projects and strategies, but also to make analysis on how to prioritize projects and investments? So I think, yeah, that's in the first place. Back to you, Salim,
Sure.
to provide an answer on that.
Yeah, like to insert solutions, yeah, and projects, you can put projects and stuff. I think we need to improve at the level of the strategies. That's like what we need to improve at. You can upload your strategies, but it's just given. So it would be good that like it's more searchable, more like easy to bring in. The prioritization that comes with the strategies, because we cannot decide on the priority of a country globally, like it doesn't make any sense. And then I think that what you already mentioned, you define your strategy, you define your architecture, and you link into your architecture to be able to execute what you need to execute or strategies that you define. And that needs to be kind of like done at the country level. But definitely I think all together at the global level, we can help at the global level, we cannot like act at the country level completely. Like we can act like in a way in the strategy level. We make sure that like everybody is aware of the strategies. We make sure that like the stakeholders that are coming to play in your country a role, that they know the strategies, that they're not gonna like go out of the strategies that you are set, that like the country sets for itself. We can make sure that like you can as well look at other strategies that are executed by others, so you can maybe take from them or inspire or say like, okay, this our strategy doesn't include this kind of thing, so that could help like put in place like policies, or you see other policies that are executed globally and you say like we might need something similar that could solve my problem, because the policy here is to kind of like channel people and solve. So yeah, for sure we can do more at this level, but mainly what we need to see is like the policymakers, we need to work more with the policymakers here and everywhere to say, okay, this is what I need, this is the answers I need.
Yeah.
Then we would value proposition. Yeah.
Yeah, sorry but I wanted to pick up on that, because that is indeed also something we've been working on with you, where we as BETTEReHEALTH have also been reaching out to a number of policymakers in different countries and trying to assist or guide them and also encourage them to submit information, and then also to see, or to make sure they know how and where to submit it and how to create, let's say, a login on the platform. So that definitely, that may possibly also in the longer term address this question or this request, is that there is assistance available. And then of course in terms of prioritization, I think you mentioned it all depends on the strategy, but maybe that's also something to look at in terms of tags, or the way that people can search or find information if they submit certain of their requirements or the things they're looking for, and if then the information or the results that they receive sort of appear with the most relevant on top, let's say, just like any search engine. So yeah, I think very interesting point and question that was made there, that can also help to develop further. And I didn't explicitly mention it, but I wanted to say that also we at BETTEReHEALTH, in view of longer term sustainability and making sure that also the information we are collecting in our BETTEReHealth registry, we're actually feeding it further into the DHA as well, so that it becomes part of that global atlas of an inventory of solutions and policies. So I think that's a good collaboration that we have set up there as well.
I think one thing about the prioritization that we could mention, and I see a value proposition that should be given, that like the country can define, and I hear like, you know, you define your architecture, but then you prioritize some architecture, like components or execution or policies or whatever, and you say like, maybe we could provide with like a way to communicate with the implementers and the donors and say, we are prioritizing this kind of, we are prioritizing our like, you know, this part of the system right now, and then be able to communicate this kind of information. I don't know if like Dawit or whoever presented, it was you who presented more about the architecture, like the national architecture, digital architecture or ecosystem. It's something that would be considered like in a way to help communicate what are the prioritization or what are we prioritizing, what kind of projects we're prioritizing right now, or we want to engage in, or that are important, that could be like helpful to show to other stakeholders, this is where we are focused on to execute. For example, like very often would be like, okay, the infrastructure is not here, so we are focusing on projects that are like more in infrastructure right now, before going into implementation of like the software level or other things, or we are focusing on interoperability right now because we have a lack of interoperability between systems, or this kind of things that could be like something to kind of like put as a flag, or to enable like some kind of communication between the stakeholders, to at least like from the governments, from the countries to the stakeholders, to say, this is where our focus, we are all focusing, the strategy right now is focusing on these items, or something like that. That could be interesting. I don't know if like anybody wants to jump on this, or yeah. Back to you, Frederick.
Okay, yeah, I thought maybe some of the other panelists wanted to intervene on that. Now we have already reached 1 hour and 15 minutes, so I think we can about wrap up the webinar, but I just wanted to check if any of our panelists have any final comments or requests, or let's say suggestions for further work and development, or the direction that Digital Health Atlas should take. Or of course, if anyone in the audience still wanted to raise a question or make a comment, feel free to put that in the chat or the Q&A window. So just some concluding remarks or inputs from each of our panelists.
Let others start, and then I'll finish. Dawit or anybody? Sam?
Yeah.
Okay. An issue of data for the Atlas, I have a suggestion that makers should build some sort of compliance mechanism where data can be sourced and in time and coherently as a policy. I think that will also enhance, build the data, the Atlas in such a way that it will, users will see it as having the right data and then on time.
Okay.
There's no compliance mechanism and there's no guidelines. We may not have a coherent data. Some areas of the country may have data readily available. Other areas of the country may not be able to produce those data on time as is needed. Thank you.
Sure. Makes sense.
Okay, just to add very few words in my side. So in this kind of engagement, maybe we can think about having a certain kind of platform is one thing, but we can also talk about the governance frameworks, which will be, as the end of the day, guide the tools we have at hand to our advantage. So the WHO Digital Atlas or the platforms like the BETTEReHEALTH platform can think about like what kind of governance frameworks are essential for countries to benefit out of Digital Health Atlas. And also standards and policies and guidelines, as you mentioned, Frederick, in the beginning. The solutions we have in different parts of the world. If you take in our part in Ethiopia, we don't have such solutions which are still exchanging data with one another. So we have to talk about standardization, interoperability, and the like. So we have the solutions with our platform. Then we can, on top of that, think about how can we proceed with making this solution talking to one another, what kind of standards we should develop so that both at data level and in the exchange level. So this kind of framework instruments can be more useful on top of the initiation we have at hand. So that's from my side. Thank you. Over to you.
Sam, you want to take over?
Yes, okay. So I want to add that I share the view that the DHA is very critical in terms of policy making, and that we have to do whatever it needs to be done collectively to make sure that the initiative is successful.
Yeah. Thank you for that. Yeah, no, like maybe one thing from my side, I think like a lot of things have been said during this meeting. I don't know, Matt, it was recorded, I guess. So it'd be good that like we compile all these like inputs somewhere like in a paper that, with the bullet points, so we can, and then who would say them so we can come back to them like or afterwards, because 1 hour and a half or 15 minutes is not enough to go through everything in a proper manner. That's it from my side. Thank you all.
Okay, well, thank you indeed. And yes, there is follow-up to be done. Actually, as a matter of fact, the workshops that I mentioned are regional workshops in Tunisia next week and Ethiopia the week after. But we'll also address the Digital Health Atlas and continue this discussion a bit further, get also new and additional inputs, but also interact with additional participants and stakeholders also from other countries, also people involved in policy making or active at the policy level in their countries. So that will definitely also provide additional useful and valuable input and insights also on the requirements and the needs from the field. So all that put together will definitely help to continue to shape the Digital Health Atlas and continue to make sure that policymakers in different places engage with the Atlas in terms of submitting and providing info, but obviously also getting useful information and analysis out of the Digital Health Atlas. So with this, I would indeed like to thank you, all our panelists, and of course, all our participants. If you have any questions to any of our panelists or to us at BettereHealth, feel free to reach out to us. We'll put you in touch with the relevant people or persons. And then we look forward also to seeing you in some future webinars that we will still be planning over the next months. Or if you have the possibility to join us at some of our upcoming in-person workshops or events and conferences. So thank you all very much and see you next time.
Have a good one. Bye.
Thank you.
Thank you.
Thank you.